Hey guys, welcome back to Medical Coding with Blue. Today's episode is how to find a job in medical coding in 2021. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. All right, so you are a brand new medical coder. You got a couple of things stacked up against you. One, you have no experience and you just got your certification and you're seeing that everybody is asking for experience. 1 year, 3 years, 5 years. They say you got to have all this experience. And how am I supposed to get experience if no one will hire me? That's number one. Number two, we are still in a pandemic. We are still in a pandemic and it is so difficult to get out and about and do the regular things that we would do normally if we were out looking for a job. All right, so I want everybody to know that this episode was inspired by a poll that I put out earlier in the week when I asked the question, and I put it in my YouTube community tab. I asked the question, how did you get your first job in medical coding? And the reason that I asked this is because I want my fellow veteran coders to weigh in on how they got started, because you all know my story. If you've been with my channel for a while, you know how I got my start. I had to go through a temporary agency in order to get my first assignment. And that was how I got my foot in the door, and which led me to my current position here. So I will be forever grateful for going through that experience. But it did take me a while, and I did go through the rejection. I went through 2 months of rejection, and it was miserable. And a lot of people think that, well, 2 months is just really short. 2 months is an eternity, especially when you are working in a minimum wage job, which I was. And I was working multiple jobs, just trying to stay afloat. Because when you are working minimum wage, you have to work twice as hard, 3 times as hard sometimes, in order to keep up. And even having hardly any bills, still, I mean, you're still trying to make it. But the thing that was driving me was I was in a program that they had paid for my education, and if I didn't get a job, I was going to have to pay it back. And I did not want to have to pay it back because I knew I could eventually get a job. So that was the way that I was able to get in, because I had that whole time that strong desire and that not taking no for an answer. And having my start with a temporary agency was the way that I was able to get in. But the question that I had posed was, how did you get your first job? And the options that I gave were, I applied everywhere until somebody gave me a chance, which is essentially kind of what I did. I worked in a related position, like as a biller or in medical records. The other one was a friend or colleague hooked me up, and I did an externship. So those 4 options, the number one that 51% said that they did was they applied everywhere until someone gave them a chance. And the other one was I worked in a related position. That was 22%. A friend or a colleague hooked me up. That was 10%. And an externship was 17%. Okay. I asked the same question on LinkedIn, and they said 44% said they applied everywhere. 22 said that they had an alternative job first. 22% also said that a friend or colleague hooked them up. And 11% said they did an externship. So this is just different varieties, different options of how people got in. But being stubborn and not taking no for an answer is what you have to do. You have to be able to develop a thick skin as well, because taking a lot of rejection in the beginning does get to you. And I'm not going to lie, that is probably one of the hardest parts, is when they keep telling you, no, well, you don't have experience, you're passing our assessment test, which I will talk about the assessment test here in a little bit. You're passing our assessment test, but we need you to have experience because that's according to our policy. And I always encourage people who are getting into the degree programs and who are perhaps sitting for their RHIAs or RHITs, and they have some influence in how the hiring is handled, to take a chance on new people. Because that is the one thing I really wish would change about this industry, is that why do you have to make it so hard to get in? And the fact that there's some people that just can't take so much rejection, unfortunately. And it's it's such a waste of talent when I hear that people say, well, I couldn't get a job, so I'm just going to give up. And it's heartbreaking. I mean, it literally breaks my heart, because the thing is, I love this field. I know the fulfillment that I've gotten from it. And I know that every day I just love it more and more. And you know the saying, if you love what you do, you never work a day in your life. I love what I do. And I have said that from the beginning of my channel, that if you love what you do, you never work a day in your life. And I feel like that. I feel like I'm not working when I go to work. And it's not, oh, well, you must be a social person, that you're always socializing when you go to work. No, that's not the case. I educate my providers. I build relationships with them, and I get my work done. And not only that, the clinics that I have worked in have benefited from that, because the level is elevated every single time. I've had to rescue clinics who needed a good, strong coder to get them back up to where they needed to be. Where's the problem? Where's the issue? Okay, it's this, it's this, it's this, because this provider's not being detailed. How are we supposed to know what's happening when there's hardly any detail? Working with them, being hands-on with them. And that's the thing. I didn't get like this overnight. It just happened, but it took time. So when I hear people just stop even before they start, well, I couldn't get a job, so I just give up. Did you try to go different routes? Did you try to go in through medical records? Did you try to apply for prior authorizations? Did you try to apply for a medical billing position? Did you try to apply for risk adjustment coder? Did you try to apply for anything that could get you into the department where you're going to be around the people that are hiring? Well, we know so-and-so has a credential. Let's, we have an opening. Let's go ahead and give them a try. And I've done many videos about alternative positions for brand new medical coders. So don't think just because you got your certification and you can't get a job in medical coding right away, oh, I got to give it up because it was just a waste of money. No. That's when you really got to dig deep, and you've got to try to get in some way, somehow. And I always think about, like, if you truly want something bad enough, you will do anything and everything you have to in order to get it. So that is the thing that you have to do. You've already invested time, and who knows how much money you've invested into getting in and paying for the program and things like that. Whatever you had to do, right? And then to just give it up. So I want you guys to really think about this. And I'm going to share some of these stories because some people were so gracious in the community tab to share their story. And I'm going to read a few of them that posted their story on how they got their first job. And hopefully this will inspire you and let you know that other people have been down that same road that you're on. But it's not only exclusive just to you. This happens to a lot of people. But these are their stories and how they got through that. So the first one is, I secured my first coding position through a former instructor of the program that I completed. She had left the college right after I had graduated. She contacted me and encouraged me to apply at the company that she was now employed with. I did. I went through all the usual steps of testing, etc. And with the recommendation from her, I was hired. You never know who's watching, where that opportunity might come from, so always show others your dedication and your integrity. It can definitely make you stand out in the crowd. And I love that. I love the fact that this viewer was so engaged and she was so involved in what she was doing that she stood out to her instructor. Her instructor was like, okay, I know this person's going to be really good. And she took her under her wing and she got the job. She went through all the steps and she got the job. So again, that's a very good thing to point out, that you have to show all the time and you have to be on your toes and you have to be ready because you never know who is watching. The next one is, I worked as a medical biller for a year while applying everywhere. And then my current employer gave me a chance, even though on paper I wasn't qualified, but I'm qualified now. Way to go. Because that's it. That it's having that work ethic. And think about this. This viewer was applying everywhere. So her employer was like, oh, no, I'm not going to let this one go, because they knew that she was dedicated. I'm just saying. And the next one, it was, but the last story to share is, I started in the medical records department, and once a coding position was opened, I applied, took their coding test, interviewed, and was selected. I have until December to sit for my CCS. I had already passed my coding test through AAPC in 2015, but unfortunately, I let my certification expire by not keeping up on the CEUs, or continuing education units, since I wasn't working as a coder, and I didn't think I would ever get into a coding job. Big mistake. Now I'm working for our local hospital, coding outpatients and physician-based ER visits. It's hard and stressful, and there is so much to learn, and it can be overwhelming sometimes. Yes, but the more time you spend with it, the better that you will get, the more easier it will be, as far as like how you're recalling things or how you know things. It is about investing more of yourself. There's so much growth with this field. There's so much intellectual stimulation with this field, and you won't get bored with it. And that's something that is appealing to people who are intellectuals, is that they won't get bored, because they're constantly going to have that puzzle. One of my favorite all-time shows is House. The show House, MD. I love that show. If only there was a real life true House doctor, right? But those shows, they're all modeled after actual cases. So, that's a little bit of show trivia for you. But you ever notice, if you watch the show, he never got bored because he had his puzzle. The only times that he did get bored was when he didn't have a puzzle. But when he has his puzzle, then he's having to think, and he's having to engage with his team, whatever the case may be. But he still had his puzzle. It's like medical coders. We have to have the puzzle. And yeah, do I have to have the puzzle? Yes, I do. I do have to have the puzzle. And sometimes it's a very aggravating puzzle, especially if I can't figure it out, or if there's missing information and I got to do a query and I got to do this. But then in those times when I'm looking at those records and I'm thinking, wow, this is actually incredible. I love the way this provider documented. This detail was so awesome. They listened when I gave a class, and now all of the information is there. And I'm like, oh my gosh. But I wouldn't have this feeling if I didn't keep going. So if you're out there and you're having a hard time, keep going. Look at what you are presenting. Look at how you're presenting yourself. If your resume needs to be brushed up and reviewed, and you really need to get it looked at, don't hire a professional resume writer. Whenever I see people who do that, who delegate that off to a professional resume writer, the professional resume writer is expensive. That's number one. Number two, they're not going to know your skills like you know your skills. They're not going to be able to describe them or to be able to put them to paper the way that you can. They know things in a canned response type of way. They're more concerned with the aesthetics and making it look nice. You are the one that's going to be able to put in whatever skills that you have. Now, I do offer resume reviews. I will leave my rates in the description box below. But we basically go over your resume, and I look for the things that I know is going to help to dress it up. Or, we look at your skills and how you can apply them on this page. So that is something that, if you're interested in that, again, I will leave my rates in the description box below. Check it out if you're interested in that. But your resume needs to be custom for every single place that you're applying. It cannot be the same for every single place. If you are using the same resume for every single place, I can tell you that's probably where you're going wrong. And if you have the same cover letter that sounds just the same as everybody else's, I'm hardworking, I'm looking for a job, I don't have experience, you don't have to point out that you don't have experience because they already know by looking at your resume. So your cover letter needs to be as custom to that position as much as possible. So again, there's a lot of things that you have to look at. And if you're doing the same thing and getting the same result, which is not getting callbacks, then you need to think of another approach. But whatever you do, you cannot give up. So if you see that they're asking for 1 to 3 to 5 years experience, you still have to apply anyway. And right now with this pandemic, yes, it is making it a little bit more of a challenge because most times when it's normal times, people who are brand new and they just barely got their certification don't work from home. But because of this pandemic, if you apply at a place you have to physically go, like if you have to apply at a hospital, right? And they say, okay, right now we don't have our staff here, but we'll train you here on the grounds for like a week or so, and then we're going to send you home with a computer so that you can code from home. But we need to get you trained up while you're here. That's totally fine. That's something that some employers are doing right now because they know that even though we're in a pandemic, they still need medical coders. So that is one of the concessions that they have been making, these employers have been making. But I don't blame them if they are setting the bar a little bit higher, if they're going to expect you to know even more about anatomy, physiology, medical terminology. I don't blame them because when you're trying to sit there and interpret this documentation, and then if you have like a lot of questions that are basic, that's when it's going to be a lot harder. But if you're advanced, or if you know how to do your research and look stuff up, then they know it's going to be less of a burden to train you. There is going to be some training involved. Some employers will not train you though on how to code because they say, well, you've already passed your certification exam. They expect you to know already how to do the coding. What they will train you on is how to do like their electronic health record, the electronic medical record, the EMR or EHR, whatever you want to call it. They will train you on that. They will train you on their processes, which is normal, right? But again, they don't expect that you're not going to have some questions, but it's the lots and lots of questions that they want you to kind of work through some of that through on your own. Okay, so that is just something that you guys should know. But looking for those positions and working on your approach is very important, and still applying anyway, even though they're asking for 1 to 3 to 5 years of experience, is very important. I will say that if you're brand new and you just got your certification and you're trying to apply for a remote coding company, that they're probably not going to call you back because they do expect people who are applying directly for a remote position to already have experience. That I can see them not sort of wavering on. But these facilities, again, because of COVID, they're sending a lot of their employees home. Some are just sending them home immediately upon hire and be like, okay, well, we're just going to train you virtually. There's always that. But don't get scared. Just get ready and be prepared as far as you got to be prepared for anything and everything. And so that is my advice there. And I'm going to be addressing this question here in another video as well. Could you give any advice on how to prepare for the coding test given by employers? Every employer is different. And some employers I've seen, they ask anatomy questions. Some ask medical terminology questions. Some will ask coding questions and just in different specialties. So it really depends on the facility. You literally have to be prepared for anything. It is sort of like taking your certification exam, only maybe a smaller version. Some tests are 25 questions, some are 50, some are 100. I've had all three types. So really, it depends on how much you've studied. And even though you're still looking for a job, you still need to continue to study, okay? So those are my tips on how to get a job in medical coding in 2021. Sometimes you may have to start someplace else. And working in those alternative positions is just fine because you're going to eventually work your way up. Don't be so impatient that you're going to expect to start as a medical coder right away, because not all of us start as a medical coder right away. Everybody's path is different. So do what you can to get into a position that is related and that can transfer over to being a medical coder, which is like prior authorizations or working in medical records. I don't recommend working in scheduling because that has nothing to do with the medical coding side. You know, if you're doing prior authorizations, you have to be looking through the record that is and matching up the procedure and the diagnosis code. So that is more related to the medical coding side. Okay, risk adjustment. Again, you're not doing you're doing more of the diagnosis side, right? And you're trying to make sure you pick up all of these diagnoses appropriately. So that is more on the coding side. That is a transferable skill. And billing, again, that is a lot of it is transferable. So think about these alternative positions before you give up. And please don't give up. That is my fervent wish for all of you, is that you don't give up. Okay, just keep going. So with that, I'm going to wrap this one up. I hope this was helpful. If it was, like it, share it, and I will see y'all on the next video. Bye.